Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear esteemed professors and colleagues, it's my great pleasure to welcome you all to this distinguished ceremony. We take immense pride in the significant progress and accomplishments of the iTeach program, which has been achieved in just over a year and a half since its inception. The iTeach platform was founded on four core pillars: expression, providing a platform for young doctors to express themselves; exploration, uncovering the positive energies, latent potentials, and creative ideas within this emerging generation; efficiency, accelerating the professional journey of young doctors by providing them with solid foundations, principles, and ethics, thereby reducing the time needed to achieve excellence; education, teaching and training young doctors in the fields of research and lecturing. During the iTeach program, it was truly inspiring to see our young doctors striving to enhance their skills and present themselves with such professionalism. Dear respected panelists, your dedication to devoting valuable time to mentoring and shaping the knowledge of our young doctors is deeply appreciated. Your generosity is encouraging these emerging ophthalmologists and fostering a positive and motivating environment is invaluable. Thank you all for the unwavering support and dedication, and let us start this great ceremony. I'll invite Professor Ahmed Mustafa Abdurrahman to give the welcome word of the Egyptian Society of Continuous Education in Egypt. Professor Ahmed, the stage is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, Dr. Mazen. Thank you very much, Dr. Tariq, for the very kind invitation. And actually, I like very much the four pillars that you just have mentioned, because this means that we are sharing the same vision and mission towards the young ophthalmologists. And from the position of being the president and the founder of the Egyptian Society of Continuous Ophthalmic Education, I like very much this collaboration. And I have witnessed how the first wave resulted in exploration of very, very positive energy among the young, and how much we feel happy when they achieve something with a kind of little help from our side. And as far as I can see, iTeach is now progressing and is finishing the second phase, which means that we are going in a very progressive, constructive way. And I'm quite sure that the winners are not less than those of the first wave. And I have seen those young during the EGESCO, and it was a pleasure for the EGESCO to host the iTeach session at Alexandria, moderated by you, Dr. Mazen, and Dr. Ibrahim, and Dr. Tariq. And we have seen how much the young ophthalmologists, when they move from the virtual presentation to the physical presentation, and this is another step in their development. And I do remember when one of the young doctors just have said, "This is the first time for me to be on a stage presenting outside Yemen." I still remember this because I was so much touched by this. And it means we are doing something good at the end of the day. Dr. Mazen, if you could allow me, I'm going to share something very little, if possible. Meanwhile, you know that it will be a pleasure to welcome you again at the next meeting. It will be that time at Cairo, 13th and 14th February. And we will have the same, the iTeach session, where the winners, or some of the winners, will present their materials physically. And this year, we will probably have some guests from the European and American sides, beside the Egyptian and the Arab young ophthalmologists. So you can just see this as and I do remember that the young ophthalmologist receiving the award right now was just mentioning, this is the first time in my life to present. And then you can see that you were so generous, and iTeach really was very generous with the young ophthalmologists. And then again, yeah, good. Next, Dr. Mazen. Yes, and you can see how much everyone is really happy from the heart. Next.
And look, Yusuf was
Uh,
attendee. Now he is amongst us.
Great. Now the whole group, as you see, and all the presenters, and you can see they are at the middle, and then they are surrounded by professors from all sides, which has a nice meaning. And this is just a photo at the end of the EJSCO gathering most of the young ophthalmologists. And we are looking forward to continue this collaboration, Dr. Mazen, and come with with the winners of the second phase and present at Cairo. And at that time, there will be, you know, that another new vibes where young ophthalmologists are very active, shining. So that let us enjoy those moments, inshallah, and kindly accept my invitation. All my best wishes, heartfelt wishes to you and the whole group. And thank you very much.
Thank you very much, Professor Ahmed, for nice words and for the kind invitation. Now, I would like to invite Dr. Rashid Al-Saidi from Oman. He is well known, no need to be introduced. He is our great brother and friend, to give the word of the MIOC, the Muscat International Ophthalmology Conference. The stage is yours.
Thank you very much. I don't know what to say after Prof. Ahmed, what he said. And recently I was with them in Cairo also. I don't know where my position actually, but Professor Mazen, he did a great work. I'm sure, and everybody agreed that with me that behind this result, what we see today, I'm sure there were a lot of work done for the last maybe more than one and a half years maybe started, but before it, there were a lot of preparation. I was not with them, but I thank Prof. Mazen that he gave me chance to be part of the small part of the whole this program. Thank you very much. First, when we say for our brothers, Yemeni doctors, actually, Oman, always since long time, we are cooperating very much. And they are coming freely to Oman, and they are all accepted to come Oman as brothers with their families. They are coming, and so they are to use our MIOC platform for second editions for they'll give their talks, and they will be awarded in this also something add on in our MIOC names. We believe in this very much because first of all, we are like small countries. So when we work with our colleagues, when doctors from Yemen, from other countries, they come, we don't consider them as guests. We consider that part of the MIOC. They are giving our conference bigger name. Because most of the time, actually, MIOC, you see our colleagues from Yemen agreed with me, Professor Mazen always with us, that most of the attendees of conference from outside, number of ophthalmologists not so they're coming. When they come, they enrich the conference. We don't say they are coming to visit us. They are part of the conference. So actually, and this part, like Sinjab Academy, all others bodies, they are coming, they are joining us. For example, this year IKS would be with us. Dry eye will be there. We'll have session on dry eye. It's a new society. We are bringing things together to for our local doctors. We cannot and travel all to attend conferences in other countries. And this is what we say in Arabic, is tashrif. Tashrif was good with us, and they are always with us, I said. And now Professor Mazen gave up. And I would like to welcome you all in Muscat. And as I said, this tashrif lana. And our MIOC going to take care of your visa and your accommodation and your regret and any help regard the travel cost.
So, mashallah, jazakumullah kul khair, Dr. Rashid. Yani, that's so, yeah, so exciting to everybody, including the doctors and the professors. And I'm sure that all are welcome to attend the AGESCO and the MIOC, including the professors. I'm talking on behalf of both of you. I'm sorry for that, but I feel that your conferences are mine as well. Thank you very much, really, for your generosity.
Thank you very much. You are welcome.
Thank you very much.
Thanks.
The iTeach program was designed by Sinjab Academy to encourage young ophthalmologists present their knowledge professionally in terms of scientific content, presentation layout, and discussion skills.
In continuation of the scientific competition for young ophthalmologists and as part of Sinjab Academy's efforts to support young doctors, the second competition of the iTeach program for the year 2024,
I'd like to express my gratitude to the panelists for providing young doctors the opportunity for enhance their presentation skills and to expand their medical knowledge.
I just have a few questions for you. The main issue with your presentations that I felt that is a bit outdated. I mean, nowadays we do not recommend at all using atropine 0.01%. I'm sure we are aware of the last study that was published by the BADIC group in 2023, and they found that 0.01% has no value at all in preventing myopia progression.
Was held. A total of 25 talented doctors from various countries, each bringing their unique perspectives and experiences, participated in the competition.
Assalamu alaikum. I would like to thank iTeach board and the Prof. Mazen Sinjab for this chance. I have learned a lot from my 2 participations in iTeach, and I wish to share in all teaching activities in Sinjab Academy in the future, inshallah.
Yeah, Professor Mahmoud Shwail, please.
Thank you, Dr. Arima, for excellent presentation. Everything was clear, and you stated the facts, so thank you for that. Now, I just want to ask you a few questions. So, number one,
the program facilitates the professional development of young doctors by guiding them through various levels of engagement.
With retinal imaging, it's going to be available with time, but what do you think are the limitations of ultra-wide field imaging?
Participating in iTeach research competition for young ophthalmologists was a tremendous honor. For me, it was very fruitful and insightful competition. Thank you all.
The first question, you consider it as a first-line treatment for all types of orbital angiomas, or you have criteria for inclusion, either it's a macro or cyst?
They were divided into 2 groups, one focusing on scientific research and the other presenting clinical cases and scientific topics. Each participant had the opportunity to present their work via webinars, which were then evaluated by esteemed scientific committees.
It's my privilege to participate in iTeach Season 2, which helps us to explore new ways and new ideas to identify ourselves and our knowledge and get benefit for our academic career.
In the slide of ocular examination, you comment on the abnormal head posture, right, no left. Abnormal head posture is
not relevant for our
usually not right or left.
It was a great honor to me to participate in iTeach program, second competition for young ophthalmologists. It added to me a very great experience on research study. It helped me to prepare well-formed and well-constructed presentation. Also helped me to select most updated topics to present. It also gave me more self-confidence to present myself and to present my knowledge. I'm very thankful to Dr. Sinjab, Dr. Tariq, and all organizers of this program.
Initially, they presented clinical cases, then progressed into discussing published studies, and eventually presented their own research projects.
Generic name. When you mention for the gonio, you mention this is with the gonio is angle closure. With gonio should mention this is how much the angle is closure 0 and what is the classification.
At the end of iTeach second competition, I would like to thank all panelists who judged this competition, as well as I would like to thank all young ophthalmologists who participate in this session.
The evaluation was based on standards designed to reshape and enhance the candidate's performance. 10 doctors were selected as winners of this competition and will receive grants to attend international conferences as a kind of encouragement for their achievements.
Greetings everyone. Thank you so much for giving me this opportunity to present in this prestigious iTeach competition. I thank Professor Sinjab and his team for this wonderful opportunity. Thanks again.
The iTeach program is a global program that welcomes any participants across the world. iTeach, the stage is yours. Now I would like to invite Dr. Suzanne Abdul Karim from Iraq to give the word of the evaluation committee. Dr. Suzanne.
السلام عليكم ورحمة الله وبركاته. زملائنا الأعزاء. At first, I would like to thank and gratitude Dr. Mazen, Prof. Mazen, for your idea to gather all these young ophthalmologists and let them try to share and compete in their knowledge. In fact, I will say it in Arabic: زكاة المال لبعضه أما زكاة المال نشره وتعليمه. So all the panelists, they took some of their time, which is precious time, from their family, from their academic work, from their patients, and they participated in this competition. We are so happy. We are so glad. I myself, I was honored to be one of the panelists. I felt that what we are doing, it is the beginning to start what we should think about that. Our region, it differs much in the data which is available from what is written in the textbook. The guidelines and the protocols and the textbook are written depending on the West countries. They wrote there. It is not our data. So we should start. This is the beginning. I think these researchers and these young ophthalmologists, they should cooperate between different countries, the Arabic countries, to do and collect the data from the Arabic region. And maybe we'll put our guidelines, we'll put our protocols on our textbook, because we have different ethnicity. We are much different from the others. Of course, EJESCO, Dr. Ahmed Mustafa, they did a great deal of honoring the competitive winners in the first, and they are doing it again. And Dr. Rashid in Muscat. So let's hope the third competition will be next year and we will come all together. Thank you very much.
Yeah, thank you very much, Professor Suzanne, for the nice words and for the encouragement. Of course, you were very active participant indeed in every session. So thank you very much. Now, Dr. Tariq will give us an overview of the submitted topics, please.
Yes, first of all, I would like to thank all panelists and all young ophthalmologists to who participate in this second type of iTeach competition. All submitted topics classified into two groups. Group 1 research type. First of all, vault accuracy using deep learning technology by Dr. Taj Nasser. Second topic, the importance of regular eye examination in detecting and preventing eye disease among patients, knowledge, attitude, and practice. Ergonomic among ophthalmologists in the Sana'a, Yemen. Knowledge, attitude, and practice about wearing glasses in children by Dr. Khalid Al-Himyari. Sclerotherapy in lymphangioma case series study by Dr. Dunya Al-Mutayri. OCT-based distribution pattern of retinal complication in high myopia patients by Dr. Anas Abu Said. Various ophthalmic presentation of nystagmus to discover the type and underlying cause by Dr. Lamia Jamal Hamdi. Tropicamide versus cyclopentolate for cycloplegic refraction in pediatric patients with brown iridis, randomized clinical trial by Dr. Hashim Abu Sarhan. Surgical outcome of lateral rectus recession and medial rectus resection in the management of exotropia among Yemeni individuals. Second type of topics, general topics. First of all, film to smile after BTK in eye with failed LASIK flap case report. Bevacizumab avastate in corneal neovascularization following chemical burn. Posterior lamellar by Dr. Arim Al-Faqih. Posterior lamellar keratoplasty by Dr. Umar Khairi. Through the eye mystery by Dr. Zainab bin Saeed. Malignant glaucoma case presentation by Dr. Hanan Al-Hakimi. Breast flow microshunt implant, a case study on secondary glaucoma post-penetrating keratoplasty by Dr. Kais Muhaisid. Crozon syndrome by Dr. Marwa Abdel-Al. Bilateral papilloedema by Dr. Ayan Yalbinar. Second topics, next topics, can ultra-wide field imaging be life-saving by Dr. Khalid Abu Shusha. Update ICO guidelines for diabetic eye care by Dr. Mahmoud Al-Rifai. Central retinal artery occlusion with serioretinal artery case presentation by Dr. Khalid Badokhl. Ocular, last one, ocular no, not last one. Ocular toxoplasmosis by Dr. Branish. Last one, role of atropine in treatment of myopic progression among pediatric population by Dr. Taber Mahmoud. So those are all topics. Thank you.
Yeah, thank you very much, Dr. Tariq. That's fantastic. Thank you. Now, I'd like to invite Dr. Zainab bin Saeed to give, she is one of the participants, and I think you are from Algeria, Zainab, aren't you?
Yes, yes, Professor.
Yeah, you are most welcome. And
Thank you so
that's great because you could step the barrier of the Francophone and participated in English. That's a great step indeed. And really, I would appreciate if our colleagues in, let's say, North Africa, to be with us in all these activities from Morocco, Algeria, Libya, Tunisia. It will be really great. So,
yes,
Zainab,
we are working on it. Next year, inshallah, there will be more participants from Algeria. We are working on it.
Dr. Mahmoud, you wanted to say something as well. Mahmoud Shtewi.
Say, don't forget about, I have a big group now from, we just established Maghrebian young ophthalmologists from Tunisia, Algeria, Morocco, Libya, and we're having a big, and we'll have more effect. And I think, sorry to interfere, Maghrebian country now starting to give a lot of talks in English. They don't talk only in French as before. I give a lecture about postgraduate education in Algeria and in Tunisia this year, I think, and last year. And there's a new candidate going to do the exams from Maghrebian country, and we will be around very soon.
Very good. Thank you very much, Professor, for your kind work as well. And we always forget Mauritania. Mauritania.
It's with us, Mauritania. Yes, yes.
Very good.
We have. Yeah, we have our 5 countries.
Added Yemen to Maghrebian country.
Yes, okay, we'll add it, Victor Tarek. Anyway, we just establishing this unit, and I am the founder of this group from different country. And
thank you very much.
Okay, thank you. Thank you.
So, Dr. Zainab, please, you will give now the word of young ophthalmologists, and you will be followed as well by Dr. Pranish Balasubramanian for the same topic as well. So let us start with Zainab.
So good evening, everyone. My name is Zainab Ben Said. I am ophthalmology resident in Algeria. I am deeply grateful for this opportunity provided by Professor Mazen through the iTeach platform. This new platform is already a remarkable resource, transforming the way we learn and especially the way we share knowledge, taking you, our professors, as an example. Having participated in iTeach twice, I can personally attest to its profound impact on my presentation skills and confidence. The first time was a learning experience. It took a very long time. The slides were full of information. I had the idea that all information matters, and that took me a lot of time. I was so confused and disturbed. By the second time, the preparation process was much smoother. I knew exactly what elements to include in my presentation, and I conducted an extensive research to ensure I was well prepared for the question from the highly esteemed jury member. And also the impressive performance of all participants motivated me to put in my best effort. Even though I faced internet issues that time, I will work on this for the next time, inshallah. That means that I'm committed to participating in future editions, inshallah. And also, I forgot to say that this is how it impacts me in the iTeach platform, but also it helps me on stage. When I presented last time in the IPOMEC in the Young Ophthalmologist session, all advices given by the jury were incredibly helpful, which helped me get the first place. And also, while I presented in the EGISCO last year, it was very helpful taking all the advices by you professors. I knew exactly how to manage the time, how to minimize words as much as possible in the slides, and to keep only interesting points and focusing on new ideas. The presentation was interesting. So, Professor Mazen, your vision and hard work are inspiring and have made all this possible. And for that, I am very thankful. Jazakallahu khairan. Dr. Tarek, a special thank you to you for your organization, for your unconditional guidance and support. And I extend my gratitude to all esteemed jury members for their dedication, insightful feedback, and the valuable time they have invested in us. Thank you all for making this experience so enriching. I'm looking forward to continuing this journey with you all. For all the participants, I wish best heart of wishes, and I congratulate the winners from now. Thank you so much.
Thank you very much, Zainab, for the kind words and really the inciting points that you mentioned, that you really felt the impact of this platform on your performance and presentation skills. I'm very happy with that, actually. Now we want India, the India continent. We want all of you to be with us on the iTeach program. Where are you? So now we will listen to Dr. Pranish from India to give their perspective from about the young ophthalmologist participation in the iTeach.
Thank you so much, Professor. Thanks for the wonderful event. First and foremost, it is an honor from India. I want to represent Indian ophthalmologists, the young ophthalmologists from India, to say that it's an honor to share this virtual podium with such legends in ophthalmology. On behalf of my friends who have competed in this, who have participated in this wonderful event, I would like to express our heartfelt gratitude for this incredible opportunity. Professor Sinjab, the mentors, and the IT team who did a fantastic job. It's always difficult to organize such an event, and without the IT's help, it's always a nightmare for all of us to kind of take part in this event. And I want to echo the sentiments shared by our professors and by my former speaker as well. The ability to articulate an idea or our knowledge effectively across a group of audience is a skill. It is a life skill. And that skill will make us stand out in this competitive world, and it will also make our voices heard beyond borders. And events like iTeach and global educators like Professor Sinjab motivate us to become better at what we are doing, to become better teachers and to become better iCare providers. Thanks again for the opportunity, sir. Thank you.
Thank you very much, Pranish, for the kind words. And I want you to invite all your colleagues and even professors to be with us. The professors will be on the panelist and your colleagues in the competition, in the third competition, inshallah. Thank you very much. I appreciate it.
Thank you.
Now I will share my screen for the acknowledgement and honoring. Okay, fantastic. So, of course, I want to thank very much Professor Ahmed Mustafa Abdul Rahman, who was from the beginning with me. I shared the idea with him. He encouraged me a lot, and we sat together, put the rules and put the guidelines, and here we are. So thank you very much, Professor Ahmed, for your great efforts. And these thanks, not only from me, it is from the iTeach participants as well. Now, I will go through the big names by alphabetical order. So I'd like to thank Professor Ahmed Awadin as well for giving the time, precious time. Professor or doctor, now he is professor. We saw that he has been granted the professorship title in Germany, Alauddin Abdin. So thank you very much, for Ala, for being with us and giving us your time. My dear friend, Dr. Ali Sheikha, the friend of the Faculty of Medicine since we were very young in 1987. Dr. Ali Sheikha always supported all activities that we do. Thank you very much, Dr. Ali. Of course, Dr. Ali Yagan from the UK, thank you very much for the great efforts and for the valuable information you always give us, especially in neuro-ophthalmology. He is a pioneer in the neuro-ophthalmology. Dr. Barak Qubaisi from Syria as well, thank you very much. He is a cornea consultant. Of course, our great friend and brother, Professor Hussam Ziada, and many congratulations on the professorship title as well in the near future. Our great brother and mentor, Professor Ibrahim Taha Al-Adawi, who always gives us really positive energy. He says the opposite. He says that we give him the positive energy because he is humble, but actually he is the one doing so. Of course, our dear friend from Palestine, our great brother and Dr. Iyad Habil, in spite of all circumstances, you participated in order to support the iTeach program. So thank you from the heart. Of course, our dear friend and brother, Dr. Mahmoud Chouail. Professor Mahmoud Chouail is working in Saudi Arabia, and really, I love his comments. I love his talks in the conferences because he always gives the things that nobody pays attention to. Thank you very much. Of course, our great mentor, Professor Mahmoud Shtewi from Libya. He is a great active man who always supports young ophthalmologists everywhere, not only in Libya, but everywhere. Thank you very much. Our great friend and brother, Professor Muhammad Saeed Al-Himyari from Yemen, who is the quiet soldier who always supports, who always assists, but he is behind the scene. Our sister, Professor Sumaya Hanafi from Saudi Arabia, thank you very much for being so supportive and for your always great comments and great support. Our great friend and sister, Professor Suzanne Abdul Karim Qattan from Iraq. She gives her experience in the Arab board and in the exams, and a lot of scientific activities. She puts her experience in the iTeach platform and supports us in every session. Thank you very much for being so active, Professor Suzanne. Of course, Professor Tariq Qatamish, the humble man. When you sit with him, Professor Tariq will show you really the science with a very humble manner. Thank you very much, Professor Tariq, for being so supportive. Of course, my great friend and brother, Professor Tariq Muhammad Duais from Yemen. Without him, verbally, without him, this effort cannot be done because he looks for every detail. He takes care of all participants, he takes care of all as well panelists. He organizes everything. So he puts everything together in order to be here together. Thank you very much, Dr. Tariq. And finally, our great young doctor, who was one of the competitors in the first competition, but his outstanding performance let us say, please come to the stage, and we are honored to have him with us. Of course, special thanks for Professor Ahmed Mustafa Abdulrahman for hosting the iTeach session in the first competition in the IGESCO, last IGESCO, and for offering us to come as well to the second to come the next year IGESCO. So thank you very much. Special thanks as well to Dr. Rashid Saidi, the head of or the president of the Muscat International Ophthalmology Congress, to host as well the iTeach session in the conference coming in this November. So thank you for being so generous, Dr. Rashid, and so supportive. I'm so happy that you are with us. So, of course, we want to thank as well Professor Rashid Abdul Ghani. Rashid Abdul Ghani, he is a statistician, he is a physician and statistician. He was so kind to devote about 5 to 6 sessions of his time to give A to Z how to write a research paper, starting from collecting the data, study design, and ending up with the publication of the research paper. Those 5 sessions or 6 sessions were one of those most important and successful sessions, and they gave a lot of positive energy for the second competition that we are here for. And those sessions are available on the YouTube channel, on Sinjab Academy YouTube channel. You go there, you will find iTeach playlist. There you can find those videos that will summarize everything for you. You don't need any other textbook to go through. You just need to go through these 5 to 6 sessions, and you will be all fine. Of course, again, Dr. Tariq for being so supportive, and of course, our great professor, Mahfouz Bamashmous, the head of the Yemeni Ophthalmology Society, for his great support. And he is the one who pushes everybody from behind just to go forward. And now he offered as well some gifts to all participants worldwide who participated in the second competition. So thank you, Professor Mahfouz Bamashmous. After that, I would like to invite Professor Ibrahim Al-Adawi to give the word of mentors. Professor Ibrahim, the stage is yours.
Bismillah ar-Rahman ar-Rahim. First of all, it is a great honor to be part of this program, and many thanks to my dear brother and dear friend, Dr. Mazen Sinjab, who create this program specifically, and they create Sinjab Academy in general. And it is a great honor to mentor and to guide the young generations of our beloved shop, which is the ophthalmic practice, and to put a candle in their way to progress more and more in their career, and to be a mentor for the next generation, which is actually an added value to our credit. Also, many thanks to our young ophthalmologists who share and react with this program. And I would like to tell them we are all proud of you. your skills, your presentation, which were amazing, actually. Hoping to upgrade the program and see you in the next edition, the third and fourth edition. Also, many thanks to Yamani Doctor, which take the big part of the share competition. Thank you very much.
Thank you very much, Professor Ibrahim, for the acknowledgement.
Can
Yes,
I give
Dr.
one word?
Yes, please.
And the last, I will all the awards, young ophthalmologists, also the mentors and professors looking after these programs. We are going to make life easy for them. Their trip to Oman, with any help they can write to me, and if they want to also to participate in other sessions, we'll give them some priorities also, because they are doing all this like a charity work support. Thank you very much all.
MashaAllah, Dr. Rashid. That's amazing. Thank you very much. Now I'm honored to invite Professor Mahmoud Al-Shtawi to give the word of, or to give advice for young ophthalmologists worldwide.
Hello.
Hello, yes.
Yes. Good afternoon, everybody. It's a pleasure to me to to share my journey as an ophthalmologist with you in a short talk. Today, I will discuss with you how to navigate your pathway from being a junior doctor to a consultant ophthalmologist. It is the most important thing is foundation and early training is very, very important. Also choosing your specialty and higher degree and continuous learning. Also building your network with colleagues and with other society and so on. Gaining specialty skills. Also balancing clinical and research work and preparing for consultancy. Also mentorship and giving back. I think this is the main point in 7 or 8 points in becoming a good and successful ophthalmologist in worldwide. And I think nowadays, as young ophthalmologists all over the world, is a new era, which I concentrate on it in my work. I did start with iTeach with Mazen Sinjab, Professor Mazen, in the first last year. I have more time. This year I was traveling, so my time was a little bit short. And I want to thank all the Sinjab Academy staff and other colleague, Ahmed Mustafa, whom I did know him on 2012 in my lecture on postgraduate education. And I think he remember well a lot of our people who attend my lecture that time in Rod al-Faraj, and they become consultants and professors at the time. Dr. Rashid Saidi, whom I know him since 2008 or 2009, since I attended with him several meetings from now on, and I think from 2010 or so on, I'm still going there almost every other year or something. Mazen Sinjab, I don't want to be Professor Mazen Sinjab. I met him as he reminded me back to show up in Lebanon in Arab board exams, 1970, something like that. So I don't want to be very old. Also, I met Ibrahim Ladawi when he visited us in Libya. I'm pleased. I think Dr. Suzanne, I think this is the first time, Professor Suzanne Abdel Karim, first time. I visited Iraq twice, I think. But I think in the last, I visited in 1989. I did a talk about Libyan and ophthalmology, and it's what in Ban Arab meeting. It was in 1989 in March, and so that's in short. Now I wish Dr. Zainab and Dr. She's from Algeria that contact me and to get my contact details from Dr. Sinjab and also Dr. Branich from India, because I'm preparing to a big group for young ophthalmologists worldwide, especially through the Royal College of Physicians and Surgeons, where we're thinking to doing a webinar next year. And that will be discussed with Mazen Sinjab, with Rashid Saidi and Ahmed Mustafa and the other, and we choose the time, because it's not the decision, it's mine, but the time and how to run the program, it will be interfere with us. And I think this is my thing for the group. I think will be some surprise for, especially with young ophthalmologists. Now there's a big concentration from the American Academy regarding young ophthalmologists, and also Royal College of Physicians and Surgeons of Glasgow last year, as I am one of their international advisors. I introduced the young ophthalmologists in Arab, as Arab young ophthalmologists, and they accept the idea, and we get approval to run a seminar. I don't know how to do it, and we'll discuss it in due time. And thank you very much for this opportunity to talk. Thank you.
Thank you very much, Professor Mahmoud, and for the encouragement and for being so global. Thank you.
Thank you.
And now is the most exciting part, to announce the winners. Let's see. Of course, we chose with difficulty 10 winners out of the 25 participants. Actually, all participants were outstanding, but finally we could find an agreement about the winners, but because at the end there must be winners. Otherwise, all of them should be winners. So I'm going to share my screen to start showing. Okay. First, we followed an evaluation process. It was like standardized table with categories and giving a mark based on being poor until outstanding. And then the cumulative mark or score. And at the same time, this table was shared with the competitors, participants themselves. I sent them this by email, and I mentioned, look, we are going to evaluate you through this table. So prepare yourself. So all of them already know in advance how we are going to evaluate them. Of course, the prizes are to attend one of these two eminent international conferences, the IGESCO next year, which will be on February 2025, and the MIOC, which will be this year, November 2024. Many thanks, of course, to Professor Ahmed Mustafa Abdulrahman and to Dr. Rashid Saidi for their generosity. Now we come to the winners. Of course, the names will be introduced based on their order in the sessions, not alphabetical, but in the sessions. So winners of session 1, then 2, 3, 4, 5. So Khadija Bazara. Many congratulations, Khadija. Hashim Abu Sarhan. Many congratulations, Hashim. Kariman Jamal Tamam. Many congratulations, Kariman. Lamia Jamal Hamdi. Many congratulations, Lamia. Khalid Al-Himyari. Many congratulations, Khalid. Dunya Ali Al-Mutairi. Many congratulations, Dunya. Reem Al-Faqih. Many congratulations, Reem. Marwa Abdul Al. Many congratulations, Marwa. As you see, most of them are female. Always, female are better than male. Hanan Sadiq Al-Hakimi. Many congratulations, Hanan. And last but not the least, Pranish Balasubramanian from India. Many congratulations, Pranish. Of course, you can choose one of two, the winners can choose one of the two congresses to participate. You can then collaborate with Professor Tariq Dais in this. And for those who did not win, but they participated in the second competition, of course, there will be a prize. The prize is to get a coupon of $300 from Sinjab Academy to participate in any of the paid master classes that we have we are conducting in Sinjab Academy. We are conducting the refractive surgery masterclass, modern cataract surgery masterclass, and oculoplasty masterclass. So you have this coupon. Later, the secretary will send you these coupons. You can use it in any of the master classes of your choice. Finally, the theme of the next competition is to conduct your own research in collaboration of Infinity, which is the artificial intelligence engine that we created on Sinjab Academy with the Sinjab Academy AI team. The Infinity is an engine that helps you to find all the science since 2000 about any topic in ophthalmology of your choice. So you just go there, visit sinjabacademy.org. You will find Infinity, click on Infinity, and it is user-friendly application. You just go through it. It is for free. In order to conduct your research, it will help you a lot, and it will save a year of time. I am serious with this word. It will save a year of time in conducting your research. So thank you very much, everybody, for being with us. And really, it was amazing to see all of these professors giving their time, even with being with us in this ceremony. Really, no words can thank you. I can say only Jazakumullah khairan, and may Allah subhanahu wa ta'ala make this in mawazin hasanatkum fil akhirah, inshallah. Barakallah fikum jami'an wa jazakumullah kull khair. If any one of you would like to give a talk or to say something, you are most welcome. We are open and we still have time.
احنا نقول جزاكم الله خيرا يا دكتور مازن. ويعني كمثل حبة أنبتت 7 سنابل في كل سنبلة 100 حبة. يعني كيف أن الخير بيبدأ وينتشر ويستمر ويعني يكبر بإذن الله ويكون مداد ويكون أثر طيب في الدنيا وفي الآخرة إن شاء الله. أنا بقول لك جزاكم الله خيرا فعلا، لأن جمعت كل هذه المجموعة الرائعة اللي أنا كل ما بشوفهم بيجي لي بوزيتيف انرجي زي ما الدكتور إبراهيم بيقول. فأنا بقول لك يعني طبعا من قلبي جزاكم الله خيرا وربنا يتقبل من حضرتك.
اللهم آمين وإياكم. إذا ننهي هذا اللقاء على أمل لقاء جديد معكم جميعا. جزاكم الله كل خير ونبقى على تواصل إن شاء الله. والسلام عليكم ورحمة الله وبركاته.